Hi, all. This is Professor Claire Thomas. It is Thursday, April 16th, 2020. And for our immigration update tonight, let's talk about immigration, physicians, and COVID-19. So, Reuters reports that 25% of doctors and 17% of healthcare workers in the United States are foreign born. That's a lot. We have a shortage of physicians, a shortage of nurses, and a shortage of other medical professionals effectively here in the United States. And there's nothing new about this. For years and years, the United States has been heavily reliant on immigrant medical professionals in order to make sure that the population of folks here in the United States, us, that we're able to access medical care. This issue with a lack of physicians is particularly acute in rural America. Healthcare in underserved, mainly rural areas is a huge concern. Although 20% of the United States lives in rural areas, fewer than 11% of physicians in the United States practice there. The result is a huge shortage, and so 20 million Americans live in rural areas that are federally designated as health professional shortage areas. Here in New York City, right, calls for volunteers, for medical professionals during the apex of our COVID-19 pandemic, we've seen an enormous response of medical professionals, but unfortunately, that's not the case in rural communities. In many immigrant physicians are on either H-1B and or J-1 visas. And so the issue is that these physicians are on contracts, and the contracts require, meaning their immigration status, that non-immigrant status requires that they only work for their employer. The physicians have reported that they typically have 10 days on, 10 days off, or 15 days on, 10 days off, and have wanted to join relief efforts in other hospitals within the same state or in other states, and they can't. Changes to employer and location require form submission and approval by USCIS that takes, quite frankly, a very long time. So these physicians cannot join relief efforts in overwhelmed hospitals. And that's a problem. I'll just back up and say that in order to address the shortage of healthcare professionals in rural America, since 1994, there has been the Conrad State 30 program. And this helps to effectively meet the health needs of rural America by making it easier for foreign-born physicians, so primarily here folks on J-1 visas who have just completed their medical training in the United States, instead of returning to their home countries as mandated by their visa requirements, under this special Conrad State 30 program, immigrant doctors receive a waiver of the return home requirement if they practice for 3 years in underserved areas. And the program, I think it's the American Administration of Hospitals, reported that this has supplied over 15,000 physicians to underserved communities. So it's a lot of medical professionals who are able to help. And so the issue is that USCIS announced an immediate suspension of premium processing for certain forms on March 20th of 2020. The forms are the form I-192 and form I-140. Those petitions are effectively the forms that immigrant physicians would use for authorization or reauthorization or changes in employment for physicians who are seeking employment-based visas during this COVID-19 pandemic. So this is a huge deal, right? We are in need in the United States of doctors and other medical professionals. There is a shortage, and people who are working in certain areas cannot, due to visa restrictions, move to other areas. So on April 6th, a bipartisan group of senators and members of Congress wrote a letter urging USCIS to address access to healthcare in underserved areas, right? The group here expressed concern that the suspension of this processing, premium processing means you pay money and it's processed quite quickly, as in within a couple weeks. So that the suspension of this premium processing will exacerbate physician shortages in rural areas and at institutions that depend on healthcare provided by physicians who graduated from foreign medical schools. So this is a huge sort of ticking time bomb of a problem as COVID-19 moves out from New York City and is overwhelming rural areas right now. We also have senators and members of Congress sent a letter urging USCIS to waive H-1B and J-1 visa restrictions to increase the number of physicians available to respond to COVID-19, meaning any type of restrictions on the ability to only work for the certain employer, to not work for other employers during time off from one's contract, right? Those kind of issues for which physicians want to freely help out in other places. So that the Senate and members of Congress, right, urged that USCIS waive those restrictions. And according to Voice of America, in late March, the American Medical Association urged the Trump administration to, quote, take critical steps to expand the physician workforce to meet the increasing demands in the American health system during this COVID-19 pandemic. So effectively, we have visa restrictions limiting immigrant doctors and their ability to practice medicine in this COVID-19 fight. Um, yeah, I mean, members of Congress urged the Department of Homeland Security, as well as the State Department, to support foreign physicians and healthcare workers. The State Department has responded, saying that folks can still apply to come to the United States, but all of this takes time, and with embassies and consulates closed and no method of expediting processing, it really doesn't seem like this will be realistic, and that the folks who could support the gross healthcare shortages here in the United States are unable to access the paperwork, right? The visas, the appointments that they need in order to come to the United States and offer their services, right, and work and lend their expertise to the doctors here in the United States. So that's just a little blurb on issues with doctors, immigrant doctors here, and COVID-19. And we'll talk about other areas, right, of the workforce here that are really rely on immigrant labor and are definitely impacted by the coronavirus pandemic as well.